I want to talk about some of the recently published guidelines for the management of lower back pain. First of all, lower back pain is really common. It's the number 2 or number 3 reason that patients visit a provider, and it's the number 1 cause of disability in the United States. These guidelines were made through really a robust review of the literature by providers from lots of different specialties, and it was a good discussion to look at these guidelines, and I wanted to share them with you. Probably the thing that came out to me that was the most important was this concept of movement. Fear avoidance, or this really long term called kinesiophobia, or the fear of movement, is a really important concept when it comes to lower back pain. Patients are afraid that they're going to hurt something or that they're going to make things worse, and so they stop moving and they avoid certain activities, and that is actually counterproductive. Time and time again, the literature points to the fact that movement and exercise is a very important part of the management of lower back pain. Specifically, aerobic exercise was mentioned as a top-level evidence for management of lower back pain. Also, general exercise is good. You may work with a physical therapist or other provider that gives you some specific exercises as well, but just general exercise is healthy. Yoga in particular has been found to be useful in managing lower back pain, and I found in my routine, if I do some yoga stretches, it's very helpful for me. So movement is probably the most important thing. Another concept is this cognitive behavioral therapy, which I think really boils down to counseling with somebody that understands this and can help coach you through some of the negative thought processes that may be going on in your mind when it comes to your back and your pain and all of these other things. If you can find a good spine management provider or a good physical therapist or other provider that can help coach you through it, there is good evidence for cognitive behavioral therapy. Another one is spinal manipulation therapy, and this is what's done by the chiropractors. There is good evidence that spinal manipulation therapy is helpful for management of lower back pain. Another one that has very good evidence for is acupuncture. And I think we forget about acupuncture, but go find somebody that does acupuncture and see if that is helpful for you. Finally, as far as medication goes, there is moderately good evidence for NSAIDs, which would be like ibuprofen or naproxen. There's a topical cream called capsicum cream. That's different than Icy Hot or some of these other creams. Capsicum cream comes from the pepper, and it creates a hot feeling that does have good evidence for decrease of back pain. So in summary, I think the most important thing is that you should try to be moving, and we talk about this concept of mindful movement. Another one is to talk to somebody about it. Understand the way your thought processes go as you try to wrap your mind around how to approach this issue in the most healthy way possible, and that's cognitive behavioral therapy. And finally, consider going to a chiropractor and exploring the spinal manipulation therapy done by the chiropractor and or acupuncture.